Very good morning, everyone. I'm Dr. Priya Singh. I'm reader in the Department of Oral Medicine and Radiology, Babu Banasi Das College of Dental Sciences. And today we'll be discussing principles of panoramic radiography. Now, before principles, it's very important to understand from where this particular panoramic has originated, from where it has got the name panoramic itself. If you know, panoramic is a wide view or an unobstructed view of region in any direction. Panoramic radiography is a technique for producing a single image of the facial structure that includes both maxillary and mandibular dental arches and their supporting structure. We can call this to be a unique radiography. Why? Because not only hard tissue, it can even show you soft tissue and air spaces. Now, there are certain other names by which it is popularly known as. It is also called pentomography or rotational radiography. The first time it was described by Numata of Japan in 1933 and Petro of Finland in 1948-49. Now, very important aspect, when to advise panoramic radiography. It's usually advised, as we have seen, it's a panoramic or wide view. It will show you large lesion. It can show you the lesions which has affected your maxillary arch, your mandibular arch, which might be a cystic lesion, benign or malignant tumor, which is not constrained to a localized area, osteomyelitis, fibrous lesion, multiple lesion, generalized periodontitis, and when patient is suffering from several carious lesion and very difficult to take multiple radiographs to confirm the depth of such carious lesion. In few cases, the patient might not be able to have an intraoral radiographic film inside the mouth because of gagging reflex. In such cases also, panoramic radiography will be very beneficial. Patients who are suffering from trismus. Trismus is nothing but inability to open mouth. So very difficult to place the intraoral film inside the oral cavity. In such cases, panoramic is indicated. To study growth and development and its disorder. Usually in cases of ortho, in cases of pedo patient, it's very important to identify the mixed dentition stage. Very important to identify when the permanence will be erupted. So in such cases, panoramic radiography will be very beneficial. Fourth is the most important aspect, to detect and study extent and nature of oral and maxillofacial trauma, whether it's Leaford 1, Leaford 2, Leaford 3, along with other extraoral radiography, it can be administered or advised to the patient. In cases of preoperative, intraoperative, and postoperative assessment in implantology, it will be very beneficial. See, in implants, it's very important to assess the amount of bone in an individual. So before taking up the patient, for the patient selection also, the bone assessment can be done with OPG, that is your panoramic view. During the procedure also, if you want to see how much you have drilled in, you can advise this particular modality. And following that, whether the bone has actually attached or osteointegration has taken place, you can again identify whether the implant is successful in the patient or not. It's an important screening radiograph when you want to see temporomandibular joint and its disorder. If you know what kind of disorder it is, you can further advise the individual TMJ views, which can be transcranial, transpharyngeal, or transorbital. Then to study maxillary sinus, since it's not only showing your arches, it even shows you the maxillary sinus. Very important aspect at times. The pathology of sinus might affect the pathology. It might lead to a feeling of pathology in the maxillary teeth. So to study maxillary sinus also, it will be very beneficial. Apart from this panoramic view, then we can advise different other extraoral views to detect and assess involvement of jaws by metastatic lesion. If it's not the primary lesion, it's the secondary lesion, then also we can identify that by seeing this radiograph as a screening radiograph. And finally, as a part of FMRS, which is full mouth radiographic survey, where you want to administer different treatment modalities. Now coming to the principle itself, principle of panoramic radiography, as I have conveyed you earlier also, it has other name, that is pentomography also. So why it's called tomography? Tomo basically is a Greek word which means any image which is taken in sections. So tomography is a radiographic technique that allows radiographic in one plane of an object while blurring or eliminating images from structures in other plane. So tomography will show you only the area of interest. Anything which is anterior to it or anything that is posterior to it will be completely obscured. So the plane which will be of interest, that is your focal plane or focal trough. So this is the plane where we'll make the individual lie his chin. So once the chin is placed on the focal plane, the area anterior to it and the posterior to it will not show in the final radiograph. It requires a controlled and accurate movement of X-ray tube head and film. Don't worry in this. Why? Because the movement is an inherent property of your X-ray machine. The movement of the X-ray film and the X-ray film, that is the image receptor, and the source of the X-ray will be modulated as per the inherent characteristic of your OPG machine. So this is how the tomographic movement will happen. The images will be taken up in section, and finally the images will be combined to have a regular final image. Dental panoramic tomography, it employs principle of narrow beam rotational tomography, but it uses 2 or more center of rotation. Narrow beam rotational tomography, it is accomplished by rotating a narrow beam of radiation in horizontal plane around an invisible rotational axis that is positioned intraoral. So basically, when we talk about our arches, the images will be as per the dentition that's placed in our oral cavity. It will be for your incisors, it will be then for your premolars, and then for your molars. So multiple center of rotation will be there. And it basically produces a elliptical horseshoe shaped focal trough, same way as our arches are horseshoe shaped. So even the focal trough where we place our chin to have the image in a panoramic is also horseshoe shaped. So tube head rotation, as I have discussed earlier, it's an inherent property of the machine. You don't have to do anything. The cassette, where cassette holder is there, the cassette is placed, and the X-ray source, the moment you switch on the button, it positions in the right way where you can take a panoramic radiography. So film and cassette will rotate in one direction and the X-ray source in the other opposite direction, but it has to move with the same speed. Very important. If the speed of any one of it hampered, the image will be hampered. So as you can see here, cassette shield will have a narrow vertical slit. It's a very important aspect. Narrow vertical slit will allow only limited amount of X-ray to move from it. Why limited amount of X-ray? Because we don't want the body, the rest of the area to be exposed in the patients. Because we have discussed earlier also, X-ray has its own hazards. So only the area of interest which can be seen with a slit collimator will let the X-ray pass through it. Film and cassette and the X-ray source will move in opposite direction. It will have images taken in section through various center of rotation, as you can see here. And finally, the various images, which is tomo in sections, will be joined to have a final panoramic image, as you can see here. Now, the source of radiation and image receptor, they are rotated around patient's head at the same speed around the center of rotation. But remember, the patient has to be stabilized. The patient should not move. So patient has to follow certain guidelines which is given by the technician who takes the image. Patient has to be still, has to be without any motion. A fan-shaped X-ray beam is directed towards the jaw through a slit collimator and the image receptor passes in front of a slit collimator, recording successive movement of the structure exposed, as we have seen earlier. When we talk about intraoral collimation, there is circular and rectangular collimation, whereas when we talk about panoramic collimation, it's usually a slit collimator. So minimal exposure to the patient is another benefit of panoramic radiography. The structures which are closer to the tube head, that is the anterior to it, get unduly magnified and therefore appears blood. The structures which are closer to the image receptor, they will cast sharp shadows. So movement of film and objects about two fixed center of rotation. As you can see here, disc 1 is nothing but multiple center of rotation, and disc 2 is the film or the image receptor. So when the panoramic image was first invented, the X-ray source was kept still, whereas the individual was moved around a disc and various center of rotation was moved. And same used to happen with the image receptor. So the first panoramic image that was invented had, instead of the patient stable, the X-ray source stable, whereas the patient was moving and the image receptor was moving in opposite direction but in the same speed. However, it has its own disadvantage, because the moment you make the patient move in an axis, very difficult to maintain stability in the patient. So the required or the desired image could not be obtained. So second, it was disc 1, which is the patient, and various center of rotation, which is your A, B, C, D, was kept still, was stabilized, whereas the image receptor and the X-ray source, they were moved in opposite direction. As you can see with the arrow, they were moved in opposite direction, but the speed of movement was same. You can now replace this disc 1 with the patient itself. Here you can see mandible of the patient with various center of rotation. And the same thing is happening now. The X-ray source and the image receptor, they move in opposite direction but in the same speed, whereas the patient is stabilized and multiple center of rotation, the X-ray is cast and images are taken up in sections. Tomo images, which is combined to form a single regular image. Now comes the projection in the vertical plane. Vertical dimension of panoramic image, it is the result of nothing but conventional radiographic projection. Focal spot in X-ray tube, a note, it serves as a functional focal spot for vertical dimension of projection. Slight negative angulation of beam, that is -4 to -7 degree, is given in cases of panoramic radiography. Now here also an individual has to do nothing. It is an inherent property of the machine itself which gives it negative angulation. Now coming to the projection in the horizontal plane. Horizontal dimension of panoramic image is affected by horizontal rotation of beam. It appears to diverge from an intraoral source. This apparent intraoral X-ray source is called center of rotation or effective focal spot of projection for horizontal dimension. Now coming to principle of image layer projection. Film moves in a direction opposite to horizontal rotation of the beam. Vertical and horizontal dimension, they match only when the object lies within a particular plane called central plane of image layer. As we have already seen that the patient jaw has to be in the image layer or the focal trough, which will show the sharpest image. Image layer or focal trough, it is a zone in an object containing those object points depicted with sufficient detail to be distinguished. As you can see here, in the focal trough, an individual is placed, which is nothing but horseshoe shaped. So the area which appears in this zone, that is the white area, it will be the sharpest, where all the details will be very adequate enough to make an interpretation in that particular zone. The gray area comparatively will be less sharp, and the black area, which is the anterior most and the posterior most, it will have the minimal visibility. So if you don't place the image, if you don't place the patient in the right focal trough, then the required image or the desired image will not be obtained. So very important that the placement of the patient should be correct. Now the movement pattern of X-ray beam, continuously moving rotation center, as we have seen that first it will be for the anteriors, that is the incisors, then it will be for the premolars, and then the molars. So continuous moving rotation center will be there. X-ray beam is given a sliding movement so that effective center of rotation is continuously shifted along a defined path. So this defined path will lead to multiple images being formed, first of molars, then of premolars, then of canines, then of your incisor, and incisors, they are projected twice, followed by the adjacent jaw, that is from right to left. Central ray of beam is always tangential to a defined curved path. It defines projection of each successive part of jaws, resulting in a continuous radiographic image. As you can see here, center of rotation is predetermined when we place the individual in the focal trough. So multiple zones, as you can see here, multiple center of rotation will help in procuring the image in an individual. We'll go back to this slide again. Anterior rotation center, path of sliding rotation center. So the movement will be so smooth that there will be no hindrance from one tomographic image, that is from one section to another section. That is why it's given the name of sliding rotation center. Very smoothly from one center of rotation, it will go to other center of rotation. And finally, the posterior rotation center of the other side. So that is how it will be, first for the right and then followed by the left side. Now coming to the equipment itself, there are three main components of your panoramic machine. Your X-ray tube head, it produces a narrow fan-shaped beam which is angled upwards at 4 degree to 7 degree to horizontal, which we had seen earlier. The second very important aspect is a cassette and cassette carriage assembly. And the third being the patient positioning apparatus, including light beam markers. So this will stabilize the patient in the machine itself. So this is the cassette, which is available at present, rigid cassette, but few of the older machines, it even has the flexible cassette. So we have seen in extraoral radiography that we utilize such films, such holders to have your X-ray film, which already has intensifying screen. That is why it's also given the name of screen films. As compared to the rigid cassette, it will be a flexible cassette. Most panoramic machines, they offer some type of positioning guides. As you can see here, it can be 3 guides which will help to position the patient in the focal trough. It can be your canine plane. So you know that you have to place the canine of the individual such that it conjoins with your canine plane of the right side as well as the left side. The ala tragus line or the Frankfurt plane, even that has to be adjusted so that a perfect image can be obtained. And then your mid-sagittal plane, which divides the face into right and left portion. Then coming to the image receptor, intensifying screens with screen films are routinely used here. As I have told you earlier, since it's an extraoral radiography, that's why intensifying screen is used, so that the X-ray which is cast on the film, it will be further intensified and the X-ray exposure to the patient will be minimal. Film size is 6 into 12 inches. Fast film combined with high speed, that is rare earth screens are indicated here. Green sensitive light and rare earth screens are the ones which are utilized. Blue sensitive film and UV emitting screens are utilized when we talk about panoramic radiography. All these aspects are very important because being an extraoral radiograph, we suspect or we know that there'll be too much of radiation exposure by all these means. That is the intensifying screen's presence, fast film, because the exposure will be minimal, exposure time will be reduced with high speed. All this will reduce the X-ray exposure in the individual to be minimal. The green sensitive film and rare earth screen, it will further intensify the effect of the X-ray that is cast on it, and the image will be optimum. Without much radiation exposure also, you will get image of good quality. The exposure parameters that we utilize in panoramic radiography: tube voltage we keep in the range of 60 to 100 kVp, tube current in the range of 8 to 10 milliamperage. Exposure time, it varies from machine to machine, but it usually ranges from 14 to 20 seconds. Target to image receptor is 14 inches. Size is 6 into 12 inches. Type of film, which I've already told, is screen film. That is, we utilize intensifying screens along with it. So here we end with our lecture. And as I have told you, panoramic radiography, it's basically a very important extraoral radiography. It will help as a screening tool, and once you are sure about which area is the area of pathology, you can advise rest of the extraoral view or maybe the advancement depending upon what kind of pathology it is.